Hi, I'm Jenny Gold, Senior Correspondent at Kaiser Health News. Kaiser Health News, for those of you that don't know, is a nonprofit news service that's part of the Kaiser Family Foundation, no connection to Kaiser Permanente. We are about 60 reporters and editors, and we all focus exclusively on healthcare. Our stories run in newspapers, online, on the radio, and on TV across the country. Go check out our website, khn.org. We do really good work. Welcome to our panel, Communicating About Complex Behaviors. There is still so much that we don't know about our health, but there's also a lot that we do know that research has settled and that strategies have proven to be successful. So that begs the question, how do we get people to actually do the things that we know work? How do we get people to change their behaviors? And that's true on the individual level in terms of exercise, diet, sleep, going to your regular checkup. It's true on the provider level in terms of getting physicians and other providers to practice medicine that we know works. And it's true on the global level. How do we get people and governments to believe in the power of global health efforts and invest their money in the right things to improve health on the population level? Each of our panelists is an expert in communicating about complex behavior. So we're going to start with a presentation from each of them, and then we're going to have a 15-minute question and answer session, which I'm going to lead. And we begin with Dr. Shiloh Beckerley of the Rescue Agency.
Great, thank you. Thank you. Hi, well, my name is Shiloh Beckerley, like was just said, and I'm going to be speaking with you today about how psychographic segmentation can support behavior change. So whether you're here today as someone from public health, if you're an author, if you're a marketer, I know we're all interested in behavior change, or frankly, you really are at the wrong conference. But I've also found recently, this is something that I'm focused on in my personal life. And I have to give this example because we are a panel of parents of young children. The other day, I was relaxing in the morning, having a cup of coffee before my kids woke up, when my son, who's sick, comes barging out of his room, dressed head to toe like a ninja. And he proceeds to start attacking our dog. So in that moment, I'm highly invested in trying to figure out how do I speak to him? How do I influence his behavior change in that moment? So I have a lot of options. I can just scold him, stop ninjing the dog. I can encourage him, I know you can do it. You can be nice to the dog. I can do consequences. If you ninja the dog, I'm taking the nunchucks away. But what is important is in that moment, what will actually change his behavior? And at this point, a large body of psychological literature, and I'm sure all of our collective experience has taught us that different people change for different reasons. Now, when we talk about nutrition specifically, you have to acknowledge that there's a profoundly complex global context that's been contributing to both undernutrition and to obesity. So we've got issues of food access, food insecurity, policies, supply, communities, and all of this has gotten us to a point where 1 in 8 adults globally are obese, and those rates are 3 times that here in the United States. So while change is needed at many levels, today I'm going to hone in on the individual message level. So we need to address the complexities of how you message to people at that personal level that motivates them to change. Because what will work for one person won't work for someone else. And I'm going to walk you through an approach that I think really does solve this. And this is an approach called psychographic segmentation. So what is psychographic segmentation? This is the process of taking a broad audience and then dividing them into distinct segments. And this is based on things like their attitudes, their lifestyles, and their hobbies. And then we can create unique messages that speak to each of those segments. So we're not dividing on surface categories, we're going deeper into something that's potentially much more useful. So here's one example that I really like. Okay, by a quick show of hands, how many dog owners do we have in the audience? And how many are medium-sized dogs? Okay, thank you. You can put your hand down. Okay, so that is categorization. That's simple segmentation. And what do we actually know about all the people there who, like myself, own a medium-sized dog? Not a whole lot, honestly. But let's do a different question here. Okay, so among all the dog owners, how many know their dog's birthday and believe it's important to celebrate? It's okay, I fall into this category too. So look around, we should all connect after this, because we might have some stuff in common, right? So this is psychographic segmentation, and this reveals potentially volumes about the people that you're working with. So what is so powerful about psychographic segmentation is that it promotes a deeper understanding of our audience. We start to understand really what makes people tick, and ultimately by understanding these messages, we can frame these differences, we can frame health messages in a way that really connects with them. And this is actually an approach that's been used for quite some time in commercial marketing. It's just not common in public health. So in public health, what we typically do is we base segmentation on demographics. And this makes the mistaken assumption that people who appear a certain way to others have similar motivations. So at Rescue, when we wanted to tackle the complexities of nutrition, we wanted to start from something much deeper than demographics. And over the past few years, we've had a chance to speak with hundreds of low-income adults in multiple states and administer literally thousands of surveys in many languages. We've conducted in-depth interviews in rural parts of Chico, California, and focus groups in the corners of dusty Colorado. And we've always led with a single research question: what do you value? And when you come with it from this idea of trying to figure out what people really value, what's really important to them, you find clues everywhere. So when you're in someone's home, you can see what's plastered all over their fridge. You can see how they report spending their time on a time journal. You can see how they talk about whatever is their most prized possession in their home. And all of these start to reveal their unique struggles, their unique barriers, and then the realities of their current existence. And with that, we're able to figure out how to message. Across all of these different pieces, so far we have found consistently 6 core drivers that seem to guide nutrition behavior. And importantly, each of these is associated with differences in health risk. So we found individuals who are driven by stability, by caring for other individuals, by experiences and sensation seeking, by personal ambition or personal goals, by knowledge, and then also some individuals who are driven by reputation or status. But let me walk you through just one example so you can get a better sense of how understanding these values can potentially help us frame messages in a way that really connects with our audience. So here, one group, caring for others. This is the group that so far we found to be the highest risk for obesity. And they really are defined by putting their own needs on the back burner and taking personal responsibility for the well-being of everyone in their lives. We're talking kids, live-in parents, everyone at work. They constantly put themselves second place and address the needs of others because they prioritize the happiness of other people. So what's been interesting is as we spoke with individuals in this segment, we saw that they were creating sort of a forced choice in their life. They believed that they could be healthy or they could make their family happy. So they could be healthy, they could make a meal for their family and it would likely cause major conflict at the dinner table, or they could create the unhealthy treats that their family loves and make their family happy. When we have that forced choice, you have to understand that the core values will always win out, right? So what we need to do when we're messaging is change the question. We need to find a way to turn this into an and statement and offer situations where in the realities of their day-to-day lives, these are compatible. So what that might look like for a caring for others individual is messages that are going to communicate that healthy meals don't have to create conflict between parents and kids at the dinner table, but that they can actually be a unifying activity that benefits everyone. We might need things that highlight how adopting fun, kid-friendly recipes can make their family happy. So we might have media images like this one from Colorado that shows that maybe they don't have to choose between family and health, but maybe being healthy can be part of a positive, family-centric experience. So for other core drivers, though, for other segments, those messages are going to look vastly different, right? So for some groups, one here is the personal ambition group. These are individuals who are high-energy folks. They're often balancing work and relationships and school and a side hustle, and they are working furiously towards a brighter future. So for them, the forced choice that they've set up is, I can be healthy, or I can spend my time working towards my dreams. Okay, so again there, we need to change that statement and give them an and statement and show them how these things are compatible. So as you can see, and what we started with, is that different people change for different reasons. And the same message that connects with our caring for other audience might send our personal ambition audience running in the other direction. So I challenge you to really seek a new way to understand your audience more deeply. And importantly, what this means is we can all stop the search for a single right message, right? Because there is no single right message. There's only right messages. And from what we've found, those are grounded in core values. Thank you.
Awesome. So I think I can figure this out, and
You got it.
there it is. All right, so my name is LeShaundra Cordier, and I'm the Associate Director for Communications at CDC. And to Shiloh's point, the thing that motivates me is Beyonce. I was hearing her earlier. I wish I had more of it. But where she was talking about the individual change component, I'm going to be talking about changing at the broader scale, but with providers. So we're going to talk a little bit about clinical guidelines and how the impact of how that impacts opioid communication strategy. So let's see if that works. Yay, okay. So I'm going to start with my bottom line up front. I'm actually going to start with the end of my presentation at the beginning. So what you see in front of you is kind of the problem statement, right? Which our ultimate problem is opioid overdoses and related harms, and how we prevent them has been the work of CDC for quite some time now. But the important part is the graphic. I'm going to tell you a little bit about how the work we did in the clinical space actually informed this graphic and our approach at CDC. So you can see on here that we are focused on building capacity, focused on supporting providers and health systems, as well as educations for consumers and state support and surveillance. Okay, I'm gonna not get click happy, okay. So the solution to our problem actually was brought about in 2016, which you can't see the graphic image, but I can. So I'll let you know that this is the CDC guideline for prescribing opioids. Has anybody heard of it? Hands. Oh, good. It's been a couple years, so I'm not surprised. But essentially, the guideline was intended to inform clinicians and the work that they do and how they have safe discussions with patients about about opioid prescribing. So working with them on the benefits and risks of opioids and helping them manage what they need to know in terms of making informed decisions. So what's important to know about this is that it was intended for primary care providers, patients who are 18 years and over, and making sure that we were in outpatient settings. So for this, I wanted to let you know that in terms of challenges, the biggest issues were stigma, misperception and misinterpretation, as well as the growing visibility of the opioid epidemic, because we kind of started this before it became the broad scale issue that you know today. So that increase in visibility caused a lot of issues with our messaging. I also want to point out that something that's important for people is when you're releasing clinical guidance, CDC is a non-regulatory agency, so I can't force anybody to do anything, although Beyonce can. And I want to go back to her. She does have a really good way to motivate people. But that also created a challenge for us in terms of helping with adoption and uptake. All right. So that slide I showed you before with those 5 kind of pillars, these are the 4 original pillars that actually outline the work that we did around clinical and provider education. So you see that we took an audience-centered approach, with clinicians being our primary audience, and we had 4 key component areas that we really worked on providing information for. And what's important to know there is that each one of those had a purpose. First, we started off with the need to distill information to really ensure that the providers we were seeking and outreaching to understood the information we were giving them, could take that information and apply it. We also worked really closely with them to support capacity. That was with training and education. Providers, as well as those that they serve, also needed that education, so we built an education model around that I'm going to talk about shortly. And then working with disseminating and evaluating our information, which 3 and 4 on the slide, the health systems intervention, and then ensure interventions were to help outreach to people who actually talk to providers. So we wanted to work with the people that worked with providers, as well as provide them with the information that they needed to make the decisions that they made. So, translation. The first kind of key component in talking about what we did and the impact that we hoped that it had was really looking at the science and the guideline itself. Like I said, distilling that down into usable, audience-centered, audience-specific content that could be tools, resources, and other components that could help them digest the information, apply the information, and implement it at a broader level. We also wanted to take the concept and the model of knowing the fact that effective communication really, and translation really works to help raise awareness, generate buy-in, which helps us with the concept of encouraging adoption, and then encouraging behavior change at a more fundamental level. If you have the tools to do it, you're more likely to do it. So we worked through that to create consumer education, clinical tools. We actually designed a mobile app for our providers. We also did digital and print resources in the form of social media, toolkits, webinars, and other provider content for them, and then worked on a suite of materials for consumers, for insurers, for state health departments, all those that healthcare providers actually work with, to help create the implementation process and help with the adoption components. We also took that information and use it to evaluate. We consistently get feedback and collect feedback from our materials to try to get a feel for what gaps exist, try to understand what resources could be improved and how to improve them. And so doing that was a kind of feedback loop that we continue to do to this day. So capacity building. Clinical education and training is a big component. And if you're trying to encourage behavior change for anybody, education and training is a big component, whether that's people who are going to be delivering your message or if you're going to be delivering your message to your end user. It's important they have the tools that they need, the information that they need, and the resources to execute and implement your changes that you want. So we took an e-learning approach and developed content around what our audiences said they needed. We asked providers, what would be helpful to you? Short webinars, done. We asked our providers, what kind of information would you like to see? All of the 12 recommendations in the guideline are covered in multiple modules across our training program and our webinar series. We also created learner-directed content, created avatars, case-based scenarios, all based on real cases, real providers, and we worked with clinicians to develop tools for clinicians. So that last two bullets of health system interventions and insurer practice interventions, we also really sat down and decided what would be important to providers. We recognize that they don't work in a vacuum. Not too many people do. Does anybody work on an island? Not like a figurative island, not a literal island. Right. So collaboration is incredibly important to what you do. And so we took that same approach. We recognized that providers needed to have more structured content in a bigger, broader healthcare system level and needed support in that space to be able to implement change. So we worked with them to focus their broader needs. We developed provider content for health systems, specifically for health systems, working with them on clinical decision support tools, integrating information into electronic health records, and helping them with PDMP integration, prescription drug monitoring program integration. So what that means is we've actually built prompts in electronic health record systems that allows providers to know when they should be checking the PDMP. It notifies them when they're prescribing doses that are higher than the allowable morphine milligram equivalent. And we've asked them to really work on thinking about what other prompts would be helpful to them that actually key into the guideline that we developed. So outcomes. I would be remiss, and I wouldn't be CDC, if I didn't say we did something successful. We got Beyonce to come. No, I'm just kidding. So one of the components of our work is that we've had an effective impact on establishing kind of clear measures of success for us. What that means for us is reducing prescribing, encouraging prescribing best practices, reducing overdose deaths. Those are our big, broad goals here at CDC, and we've achieved them. Not to the level that we would like, we're still consistently achieving them, but this just shows you some impacts. I will spare you a logic model for those of you who work in public health. We did have several, but we are starting to achieve those outcomes that we've desired. So that includes the data showing us that a majority of counties in the US have seen declines in the rate of prescribing. We've seen declines and reductions in opioid prescribing with multiple medications. We've also seen reductions in the number of patients receiving overlapping prescriptions with like benzodiazepines. And then really starting to see some of the outcomes and other process outcome metrics, an increased rate in prescriber taking education practices and going through our trainings. We've had over 40,000 learners that have completed our modules that are still going. We've partnered with groups like Medscape and others to make sure that that continues. We've had over 107,000 downloads to our mobile app, and that is continuing to grow, which means it's also being used and being evaluated. We've seen increases in awareness around the dangers of prescription opioids, not only from providers, but from patient populations. We've started evaluating and surveying consumer products and seeing that there's been an increase in what people truly understand about the risks and dangers of prescription opioids and how to better use that information moving forward. All right, last slide. So, what does that mean? So I started with the beginning, saying that I was starting at the end, and the end is that the drug overdose crisis is complex. It's a changing landscape. And as we change, and it changes, so should our messaging and our approach. It should be something audience-centered. It should kind of hit those big pillars around education, capacity building, translation and distillation of information, really understanding that the epidemic itself, no matter what it looks like, needs to have an understanding to increase awareness, the role of data and how important it is to informing resources and choices that people make, and then understanding how to better collaborate across sectors to help prevent overdoses or whatever behavior change you're trying to accomplish, and making sure you're implementing that throughout. There you go.
Thank you. My name is Sebastian Majewski. I am heading a small but mighty team at the Bill and Melinda Gates Foundation that is around the creative and around the brand of the foundation. And we've just walked from very individual to this more broader level, and now I'm going to take you to the most macro perspective that I can kind of bring to the table. I'm by training a graphic designer, but I have an interesting love-hate relationship with data. And I just try to make it beautiful. And my favorite data set is data about humanity over time. So what I want to show you a little bit is an argument that I'm trying to make, which is the best time to be born is now. So I want you hopefully to walk away from this session feeling a little better about the world. And it's hard, right? It's hard because in our daily news cycle, we're confronted with negativity. Every time we open the news, we know something bad is happening. And taking a step back and looking at this data on humanity gives you the chance to actually see some patterns in development that you wouldn't see normally. So I want to start off by showing you a chart that just shows you the dramatic reduction in under 5 mortality since the year 1990. So on the left-hand side, you see data from the Institute for Health Metrics and Evaluation looking at roughly 55 million deaths in 1990. 12 million of these 50-something million were children under 5. And what you see in the color coding there is that everything that is purple are infectious diseases that we can prevent with the tools that we mostly have today. And then you see the blue and you see the yellow color coding, and you see the legend. It's about non-communicable diseases, and it's about injuries and death from violence. So the majority of children under 5 dying from diseases that we can prevent. And if you look at this chart again, on the right-hand side, you're going to see the year 2017. The caseload of death globally has increased to 55+ million, given that we are more people. But what you see there, less than 6 million children under 5 are dying. So if you would put these two pie charts next to each other, you would already understand we were nearly half the death rate of children under 5 in the span of less than 30 years. It's a remarkable achievement. And I will tell you a little bit why, because this is not luck, that was not coincidence. And I'm going to make a bit of a passionate plea to multilateralism, to international cooperation, because in times where self-interest and nationalism is on the rise, especially in further developed countries, it's always important to remind ourselves of the importance of working internationally. So the next slide is going to show you something that has 2 different stories in it. The top is looking at some of the biggest killers of children. It is malaria, it is HIV, and it's measles. Over time, between 1990 and 2017, you see an increase in the death count, especially in the 90s and the early 2000s. And around 2006-07, where the world was grappling with the financial crisis and we were worried about the home ownership, about retirement accounts, the world seen something so remarkable, but we were so busy with negativity that we didn't even pay attention to it. We turned the tide on some of the biggest killers of diseases. You see there's peak in 2007, and since that you've seen the fastest decline of death from these diseases, something I try to find a good comparator, but there's not a lot that we can point to that say the speed of progress, the speed of saving lives is matched by other interventions. It's remarkable, but why did it happen? Because in the year 2000, the world came together with the Millennium Development Goals, said we have 8 goals for this world, we have a plan to measure it, and we have the political will to work together in a global cooperation. And at the same time, we also put money where our mouth is. So the bottom chart overlays the same time period with how much the world invested in health of people that are normally cut out of the health system globally. And you see there's an increase in spending in health, and you see a decrease in the counts of death, especially young, especially the vulnerability. A remarkable story totally gets lost in our daily news cycle about negativity. And I want to give you another reason, another example why it's important to be optimistic. So this is me filming myself doing a little bit on my screen here. So you see a chart, every yellow dot represents a country that introduced pneumococcal vaccine in the year 2008. Now I'm moving the slider and you see more countries are coming up. These countries are divided in 4 different clusters: high income, upper middle income, lower middle income, and low income. As you can see, the early adopters of new vaccines were countries with a strong health system that could afford it. In the year 2000, also, Gavi, the Global Alliance for Vaccine Innovation, started. It is one of a set of remarkable institutions that built a health delivery network that can really reach kids and young adults in places that were normally cut off. So if you go back to that slide, every dot that you see there that is purple or that is blue is a country that only got access to these vaccines because we invested in these global institutions. Without these institutions, without the political will to say, yes, we make these drugs available for everyone in the world, we would not be able to reach the kids in more than half of the countries worldwide. So why is it important to communicate this progress? Because what we see, the cost of doing that is vastly overestimated. The actual portion of the GDP of this country or any OECD country is by any citizen vastly overestimated compared to how much it really costs. We pay less than 1% of our GDP goes into these kind of international foreign aid institutions. But at the same time, we completely underestimate the progress that the world has been doing. If you ask people today, is there more or less poverty in the world today than 20 years ago? 73% of the people won't get it right. We're less. People think we are more. People, because of a lot of struggles and a lot of what you work in, and looking at your vertical, you will believe, yeah, it's getting worse. It is getting better. It's important to communicate this because when people believe that progress is real, people are also more supportive of working on it. And that is a very important and complex motivation that we're trying to convey here. And at the end of the day, why it matters, I want to show you one more map. And that is the world map taking 3 indicators. The under 5 mortality, so what are the odds of you dying under 5? What are the odds of you growing up and stunted and malnourished? And the odds of you being able to read and write when you grow up. Very basic concepts of global health. We want people to be healthy. We want people to be able to live to their fullest potential, to become someone. And what you see here is every time a dot goes up, statistically, a kid is born in that specific country. Every blink represents 1 birth. And you can see there are some places where it's green, there are some places where it skews toward red. Where you're born is completely out of your control. But it's our moral imperative to make sure wherever you're born, you have the same chances in life to be productive. And that's what global health is about. And the only way we can do that is to remind people how much we have achieved over the last 30 years. Because it's very easy to get down in a vertical and only focus on that. But from time to time, it's good to take a step back and look at what we've accomplished, because it gives us also the motivation and the conviction that we can do more in the next 30 years. So one day, with your change makers and your voice in health, we can turn this map even further to the green. Thank you.
Thank you. Those were all really fascinating presentations. So looking at the news today, things look really bad. You know, we hear coronavirus, the opioid epidemic, we hear spread of measles, we hear climate change. And as a member of the media, I can say we do aim to tell the truth, but often the stories that get told are about the things that are not working, not the things that are working and that we know are effective. So Sebastian, this one's for you. How do you separate those headlines from the real progress you're seeing on the ground?
Well, specifically what you see today is a really good question. Actually, I'm really encouraged to see how much in the media also international independent news has stepped up and said, we're going to actively fight some of the rumors that are going on. We're actually going to commit time to report on what's going on in the world. And so there's obviously a clear role and call to action for everyone here in the room to say, let's share that, let's talk about this, especially if you're an influencer in the health space, your voice matters, right? And at the same time, as a creative and as a storyteller, I also, every time I go and travel to any of the countries that we work in, I'm so impressed by a young generation that really is vibrant, energetic, and the picture that we have of the world is very distorted by this negativity. And so it requires also individual action. I should go out there and learn more about what's really going on. And I can tell you the world is full of amazing stories, and that is because people are healthy and people are productive and people can do stuff that they always wanted to do, and we just need to provide an environment, right?
Can I add something to that?
Absolutely, please.
I think something else that's important to remember is that we have to invest in as much in success stories as we do in providing information about burden and problem, and right? So we in the business of public health typically do that last. We talk about the solutions, we talk about the outcomes. That's kind of an afterthought, and it shouldn't be. And I think the more we invest in success stories in the beginning, and those of you who have to advocate for funding and who are doing things like that, you probably typically share success stories more than most. But I think if we put as much investment into telling those successes as we do everything else, it might actually help turn the tide on that.
And I'll say there has been a movement in journalism to do exactly that, a solutions-based journalism approach. So I've thought that's been really interesting. Yeah. So with these extremely complicated issues, it sounds like tailoring the message to a really specific target audience is crucial. So how do you identify and prioritize that most important audience? And Shiloh, why don't you start with that?
Yeah, sure. I mean, that's a great question. It's definitely something we think about a lot, and even in the different campaigns we've worked on, we've had to think about. But typically, it's going to be a combination of who needs the messaging the most. So perhaps with nutrition, you might pick the group that is the highest risk for obesity. And you need to balance that, though, with groups that potentially are going to be receptive. So they're already at a point where they're well positioned to make a positive change. Ideally, we would be able to, like the cigarette companies, have one that is targeted literally for every single group, have that targeted messages. But I'm a realist as well, and I know that in the world of public health, there's only funding that can go so far. So I think usually based on actual risk, and then also kind of the feasibility of reaching different individuals, you can make a cost-benefit analysis there and decide who to charge with.
So we're in the world of social media, and social media allows falsehoods and misinformation to travel at a rapid pace. So your evidence-based campaigns are out there, but so are the Facebook groups with tens of thousands of members that peddle misinformation. Take the anti-vaccination groups, the Gates Foundation, or some of the vaping groups that were peddling misinformation around the vaping epidemic, the illnesses, for the CDC. How do you establish credibility and trust in the age of social media? And to what extent do you feel that you've really made some inroads there, and where are you still fighting to establish an edge? And LeShaundra, I'd love you to answer this.
Sure. I think I'm at a disadvantage in some ways because I have a trusted, credible agency that I work for. While that isn't always the case in every community, I think it puts us in a place where credibility isn't something we're typically trying to fight for. But misinformation is something that we're typically fighting against. And I think, for every, public health issue that you mentioned, some of the things that we've been doing to combat that is to really understand the gaps of information, understand the influencers and deliverers of messages, and know where we can kind of provide integration into where we can make the change to correct that misinformation. So we actually study misinformation. It's something that happened a lot with the CDC guideline. It's something that still happens. We've done publications on it. We've studied it. We've looked at social media. We've tried to get an understanding for where the misinformation is coming from and what types of individuals are providing it so we can counterbalance it. We've also informed people of the risks of misinformation. So we let you know that, hey, you're likely going to hear this type of information from a certain entity or group that might not be true, and here's where you can go find factual information. I think we're in an age where the benefit of social media is that it is accessible to everyone, and that you're in a world where people are seeking information. So it's important to make sure that you're doing things on the back end, whether that's with SEO or working through search engine optimization, working through those components to make sure your information is prominent, and also working with those who provide information to make sure that they are putting out and disseminating information that aligns with what you want to say.
If I may add, I think roughly 10 years ago, I worked at UNICEF, and we did our first study on tracking anti-vaccination sentiment. And it's fascinating, actually, to look at now the rise of measles cases, and look at 10 years ago, where we saw the highest volume of anti-vaccination sentiment. And you can really point out countries where you could really see, based on the volume of conversations, oh, you might actually see their measles cases again. And it's fascinating that, over the span, you can see the behavior in social media and the communication actually then translate to real time and real life outcomes. But at the same time, I'm really encouraged also to see, obviously now, with strong kind of sensitivity in the media to the danger of rumors and misinformation, that there's also more volume up sound when it comes to combating those rumors actively. It's still a long way to go, but there's no easy answer to that. But I'm definitely encouraged by how much more people are sensitized to this now versus even 3 or 4 years ago.
And I think even to add to that, the other piece about that is actually understanding that everybody is an audience. We talked about the importance of tailoring and segmenting to your audiences, but the media is an audience. We've done a lot to inform the media. We've worked in, spaces where we provide them with briefings and background information, and work with, regional producers and say, hey, here's where the story is missing. Can you help us tell it? I think the same thing in, any population, any community, understanding the audiences that are giving misinformation and understanding those who are receiving it, you can fill the gap with the right information. And so it's really important, I think, to treat every audience uniquely and understand what their needs are so you can make sure they get what they need to make whatever change you need them to make.
And then just piggybacking there, I think it's also important to make sure that we are not unintentionally being part of the problem. And I think a piece of that can be, when we think about inaccurate information or whatnot, it seems very black and white. But from a nutrition standpoint, it's also really important to think about how pushing forward something as an easy solution, if it honestly does not reflect the reality of our audience, that's another form of misinformation that could be equally damaging. And so I think just taking a critical look at the messages we're pushing forward as well, and just making sure that they do reflect our audience's reality and they do meet them where they're at, is an important piece of the story.
Nutrition information in the news can be really confusing.
Yes.
It seems to change every week. Coffee is good for you, coffee is bad, wine is good, wine is bad, meat is good, meat is bad.
100%.
How do you stay on top of that and sort of make sure that you are only encouraging the information that I guess we think we really know is true?
Yeah, I think that's just has to do with what is selected as your campaign focus. And I think that despite what is a completely overwhelming level of confusion that many of people in focus groups I've led talk about, from all of this information that they're constantly receiving, there are some big rocks that we know. Nothing bad is gonna happen from drinking more water. We know that people should have more vegetables. These are clear things, and they're evidence-based. And so I think if you can just direct people away from the confusion, not let them be in a state of inaction because they're letting themselves get bogged down on the details, and focus them to those big rocks that we know are important, that goes a long way.
So many of us have really good intentions about our health, myself included. It might be our New Year's resolution, but here we are in February and we've already let it slide. So how do you get people to stick with something, like eating better or prescribing better? And how does behavior change become ongoing?
So I can add one thing with that, which I think is really interesting. But when you do segment based on values, something that's kind of amazing is that our values are primed all the time in our daily life. And so if you can really draw a strong connection between someone's values and their personal behavior, between your personal values and whatever your New Year's resolution is, it's going to actually be self-reinforcing, because you're going to see that pop up in your daily life when you consistently demonstrate that value in other areas, and it's going to connect that back for you. And so it's just one more level that lets you reinforce the message.
And then, if I may add, different ballgame, perception around human progress. What we've learned, campaigning and actively communicating about this, the regularity of touch points seems really important, because what happens, and we're all human, so we know it. Like sometimes you're opposed to a piece of information, it changes your perception maybe. But then if you walk away, you fly home, you drive home, you might fall back to your old kind of habits. So the regularity of touch points is what we've seen in our campaigns, is actually really important. And whether that's tactically through email programs or bringing people into groups or WhatsApp groups, whatever it is. Fundamentally, if you remind people, and if you go back, if you have the ability to go back through your campaign design, you have a more higher likelihood to sustain the perception change that you want to see.
So the world likes to try to make things simple, but the issues you guys deal with are really complex. Take, for example, limiting opioid prescribing, while also ensuring that people with chronic pain aren't left to suffer, and there's been a big backlash from chronic pain patients. LeShaundra, how do you communicate that kind of complexity in a simple way that resonates with people and that they remember?
Well, I think to Shiloh's point, there isn't a simple way sometimes, and so that's the first thing, is to acknowledge that. I think for us, the second thing was communicating that to patients. Is we actually went and talked to patients. When I mentioned there's more than one audience, there really is, and so we recognized we were going to be creating guidelines that were going to potentially impact people's lives. So for us, it meant really sitting down with them and figuring out, again, what the misinformation might be, what the risks are going to be, what gaps exist, and then developing messaging that resonated with them, and really explain to them what the guideline was, what it wasn't, and then that we actually do care about your pain. I think empathy and tone go a very long way in anything that you develop in any campaign and any messaging that you're going to put together, and that was the focus for us, and our goal was to have understanding and awareness. Our goal was to increase perception of what opioids potentially could cause risk. And so with that goal in mind is how we chose to make some of the decisions we did around communicating. And then we have since studied the things that we've put out and really made it a point to make sure we find out where information needs to be changed and modified and what isn't happening with the content that we've put forward. And that's been really critical for us, helping change perception in that space as well.
I wondered if each of you could share an experience of a breakthrough moment in your work.
Who wants to start?
I can start. Based on that conversation, I was just thinking about one of my early trips to India. We ran together with the government in India a program called Avahan, and I learned through going to some of the women's self-help groups in 3 different states in India. I've learned one thing about behavior change. It was a breakthrough for me to recalibrate my own thinking, because what happens is you come and you have your own opinion on something, and you say you have to use condoms, right? But then the response is, I don't care about condoms. I have way bigger issues to deal with. And so the design of that program was then to really understand what are the needs of the audience you're trying to reach before you tell them what you want them to do. And so that was a breakthrough in like the most empathetic way. Like, how can you add value to the people that you reach before you tell them what you actually want them to do? That was a fantastic learning and definitely a breakthrough how I see my work.
I think for me, very similar experience. My aha moment was really, I was actually in a provider's office getting treatment for a chronic condition that I have, and had just started working on the guideline, and my provider was haphazardly talking about opioid prescribing. And the light bulb went off when he was kind of like, really, there just needs to be something done about this. He was kind of voicing a complaint. And I was like, well, as a matter of fact, I'm going to use this opportunity to talk to you. So I actually took that time to actually sit down with my own doctor and say, like, what would be helpful to you? What do you need? And it's to that point of understanding your audience. And it was really a moment for me that was like, okay, this is important, not just for me and other people, but important for the providers that we serve. And actually having that, what should have been like a 10-minute, drive-by, because you know how providers typically, they're in and out, turned into like a 30-minute conversation. And he was willing to share and willing to provide information that I didn't think he would. And working with veterans, he used to work at the VA, so we were having all of these conversations about what kinds of things would be helpful. And then I if anyone has ever seen me talk anywhere else, I go on a recruitment tour. So I was like, do you want to be a beta tester? Can I send you some materials to look at? Because I wanted feedback from the audience I was developing messaging for. And he agreed to all of those things and still provides me care, which I'm surprised at every day. But that was my light bulb, okay, we're on the right path and we can do this and we can have an impact.
And then really quick, because I know we're out of time here, but one for me was a lot of times when we do research, we do back-to-back interviews. It's like, many in a day. And there was one case where I was in 2 different people's homes. They had the same processed mac and cheese, like the kind you microwave, in their cabinet. Demographically, these were 2 identical individuals. And then when I really dug in and asked them to describe the function that food was playing for them, it was totally different. So in one household, it was all about tradition and what they were raised on, and why that was providing comfort for them. And then the other household, it was all about convenience and the need to be meeting their goals, and they didn't have time otherwise. So that just gave me one memorable moment where it was an aha moment of you can't just use demographics and behavior, you need to go deeper.
Great. Thank you so much to all of you. This has been a really fascinating conversation. Thank you.